Hi, my name is Rachel Lee, and the disease I picked is necrotizing fasciitis. So, the first slide shows some interesting facts or just general information about the disease. So, first off, to kind of break down the name, necrotizing means causing death, and fasciitis means inflammation of the fascia. The fascia is the subcutaneous tissue or the tissue underneath the skin that acts to support the muscles and nerves in the body and to kind of just keep it in place. So necrotizing fasciitis infects those areas of the body. Necrotizing fasciitis is also known as the flesh-eating disease, which explains the nature of the disease, where it's like causes tissue death, necrosis, and gangrene. Um, the disease is also part of a bigger group of infections called the necrotizing soft tissue infection, or abbreviated to NSTI. The image on the right is shows the necrotizing fasciitis in action. It is the microscopic image of skin, fat, and facial tissue undergoing tissue death. So, necrotizing fasciitis, the causative agent for it is the bacteria. To go more into detail on it, there are two types of necrotizing fasciitis. Type 1, polymicrobial, you can kind of get from the name that the infection is due to more than one type of bacteria, poly meaning many or multiple. Oftentimes, polymicrobial infections are due to a mix of anaerobic and aerobic bacteria, and it is most common in immunocompromised individuals, which I will speak about more later. Type 2 is monomicrobial infections, and kind of also from the name, you can tell it's an infection caused by one bacteria. The more common ones are Group A Streptococcus, abbreviated as GAS, or Staphylococcus aureus. So, more information about the Staphylococcus aureus is that it is a gram-positive spherical facultative anaerobe. So that basically means that the bacteria is able to grow in both the presence and absence of oxygen, and they normally appear as grape-like clusters under the microscope. And for gas, it is also a gram-positive bacteria. It is non-motile and non-spore forming foci, so spherical. However, it grows in pairs and short chains instead of grape-like clusters. So some common signs and symptoms are listed over here. Some of the early signs and symptoms are similar to that of the flu, which include body aches, fevers, chills, nausea, diarrhea, and general pain at the site of injury. Some more localized effects, you can see probably like a mild rash around the area. It would be tender and warm to palpation, and you would see swelling to the infected site. So, necrotizing fasciitis develops pretty quickly. You would be able to see signs and symptoms within the first 24 to 48 hours once you are infected. And once it progresses, you'd be able to see erythema or discolored skin, worsening swelling, the formation of bloody or yellow filled blisters, hypotension, which is basically low blood pressure, tissue death, sepsis, organ failure, and death. Tissue death, sepsis, organ failure, and death are kind of more so the serious cases. So, before what usually happens if you aren't able to control the infection before it progresses to be too late. These symptoms and signs are often found on human limbs, fingers, toes, and genitals. For genitals, it is also called Fournier gangrene. And of these body parts, it is more often found in lower extremities, especially for diabetic patients. Usually, you can see kind of the gangrene set in diabetic patients' toes, and it kind of goes gradually up the leg. Okay, so this is a graph kind of showing the lower extremity compared to the other body parts. So you can kind of see how the bacteria affects the lower extremity more so than any other body part. The how and how the bacteria enters into the body is it enters through the mucous membrane, usually through a opening in the skin. This can be a minor trauma, an insect bite, puncture wound. It could even be a muscle strain or bruise, even if there's no break in the skin. It can also be entered through a surgical wound, most likely an intestinal wound. And the bacteria can also enter through wounds that have come into contact with ocean water. So while you're in the water, if you come into contact with raw saltwater fish, raw oysters, or just in general from handling any type of sea animal such as crabs, you're more likely to come into contact with that bacteria and for the bacteria to enter into the body if you have an open wound. So necrotizing fasciitis usually only happens if you already have an infection in the tissue. And to talk in more detail about the virulence factors, so for gas, which is a part of the type 2 necrotizing fasciitis bacteria, it uses polysaccharide capsules and M proteins to evade phagocytosis by immune cells. It produces enzymes that degrade host tissues, and it also produces toxins that overstimulate the immune system, which may eventually lead to fever and shock and would cause rapid spread of the infection throughout the body. Eventually, in the long run, this would turn into organ failure, sepsis, and eventually death if not treated. So, for the other bacteria involved in type 1 infections, so this is the polymicrobial infections with more than one type of bacteria causing the infection, it may have adhesins, invasins, and toxins that contribute to the virulence factors. In general, type 1, as I already mentioned, is a mix of aerobic and anaerobic bacteria. So generally the aerobic bacteria grow first and causes the tissue damage. Once that's done, it leads to a low oxygen environment where the anaerobic bacteria can thrive in. Once that occurs, the bacteria can then produce gas as byproducts from their metabolic processes and forms gas in the tissues. So if there's gas in the tissues, this shows that the disease has progressed a significant amount. And if it's at this point, it's pretty severe, and usually you would be able to tell during physical exams as well. Physicians would be able to palpate, feel crepitus during palpation. So, how much? Necrotizing fasciitis has a high morbidity and mortality rate. There are a lot of studies on it, but on average, I'd say it reaches about 50% mortality rate, and it was found to be up to 1 in 4 individuals with the disease that die from the infection. So this is an image of necrotizing fasciitis. It shows the difference between the healthy skin and the necrotizing fasciitis infected skin. You can see from the infected skin that there's necrosis or like loss of tissue because of tissue death. This is a more in-depth picture. It kind of shows you all the layers of the skin, and the infected skin, which is on the right, you can see has a loss of tissue due to the necrosis and infection. So for transmission, the bacteria is rarely transmitted from one individual to another. However, it's not impossible. It can occur if the individual is severely infected and comes into close contact or direct contact with an individual who has an open wound, chickenpox, or an impaired immune system. Um, Another form of transmission is through nosocomial means. This is during surgery or just in a hospital setting where the bacteria is able to enter in through an open wound into the individual's body. So this is also why it is important for hospitals and surgeons to keep their area and tools sterilized to prevent the spread of infection. Incidence reports in the United States show that there are about 0.4 individual infected individuals per 100,000 individuals, and in regions where there is higher infection rates, It's about 1 per 100,000 individuals. Kind of going into the risk factors of it, we already kind of mentioned the cuts in their skin. This is more so the general common way to get it. This can include minor cuts, surgical procedures, insect bites, and so on. There's also obesity, diabetes, alcohol use disorder, cancer, immune or vascular system issues, such as an individual who's immunocompromised, pregnancy or childbirth. It is also more likely in middle age or elderly patients. Um, However, it can occur in all age groups. It is also more likely in males, especially with the Fournier's gangrene, which is the infection to the genitalia. I've also found some studies that show that warmer climates have an impact. This may be due to the fact that warmer climates have more moist environments and that facilitates the growth of bacteria. The use of steroid medications is also a risk factor because it may lower the immune system. So, kind of comparing type 1 and type 2 um, necrotizing fasciitis disease. So, diabetes, peripheral vascular disease, individuals who are immunocompromised, and recent surgeries, and individuals who had recent surgeries are more likely to get type 1 necrotizing fasciitis. On the other hand, individuals with skin injuries, blunt trauma, or had recent surgeries, childbirth, pregnancy, injection drug use, or varicella infection due to the rash that's present on the skin, are more likely to get the type 2 necrotizing fasciitis. By comparing the two, you can kind of see the difference in the predisposition of the patients. So for type 1, it's usually individuals who have a prior past medical history. Type 2, it's more so just an open wound or cut that the bacteria can enter into. So patients are diagnosed through a multitude of ways. I'd say like the first thing you kind of do is blood tests, or more specifically, a complete blood count, and kind of see the levels of everything in your blood. More so, the white blood count, which if is elevated, shows that there is an infection in your body. Next, I say clinically, the doctors can diagnose your signs and symptoms as the ones mentioned before, and by your history. So, if by saying how suddenly your symptoms started and how quickly it spread, the doctors can use that to form a differential diagnosis and kind of narrow it down to necrotizing fasciitis as more tests are done. Um, Physical exams would also be clinically examined, such as the signs and symptoms I mentioned, as well as the possible crepitus on palpation if there's gas formation in the tissue. So, further tests are culture specimens taken from the deep tissue and tissue biopsy, which would show if there's bacteria in the tissue. With that, you can do further tests to kind of see specific attributes of the bacteria to see if it is necrotizing fasciitis. Imaging tests such as CT, X ray, and MRI may also be done to kind of show if there's injury to the organs, or if there is, how much it has spread. Some prevention methods include generally just keeping a good hygiene. So, for example, regularly washing your hands and cleaning the areas around you. Also, if you have cuts, burns, or just open wounds somewhere on your skin, just keeping that area clean. So, cleaning with warm water and soap, and also continuously changing the bandages. Some also to avoid like seawater when you have a wound. Also, additional prevention methods for individuals with liver disease include avoiding seafood consumption to avoid eating contaminated seafood, and avoiding seawater when you have open wounds. This is also the case with all individuals, but it is individuals with liver disease have a higher risk than those that don't. So, for vaccinations to prevent the disease, unfortunately, currently there are none. However, if you do end up getting the disease, there are treatment options to get rid of it. So initially, there is also an exploratory surgery that can be performed to confirm the diagnosis of necrotizing fasciitis. Once it is confirmed, patients undergo debridement surgery, which is basically the removal of dead tissue, and you would clean that area. And oftentimes, because um, you might not get all the bacteria in the beginning, it takes multiple surgeries to get everything. Even then, patients would be put on antibiotics to kill the rest of the bacteria that's left in the body. If the antibiotics can also be given to patients who have not progressed that far and before they undergo non-conservative treatments to prevent the spread of the disease. Some examples are penicillin, ampicillin, and clindamycin. IV fluids may also be given to patients with necrotizing fasciitis to prevent the spread of infection throughout the body. And after surgery, patients likely need skin grafts or plastic surgery to close the wound to prevent reoccurrence of the disease. So, some complications that can occur if the disease is not treated early on are scars, amputation of limbs. So, this would be basically cutting off the body part that's infected to prevent the further spread of infection throughout the body. You would usually do amputation when it's too far progressed to do debridement surgery. Other complications include toxic shock syndrome, sepsis, and if not treated, death. So that is the end of my presentation. Thank you so much for listening. If you guys would like to read more on it, these are the references I used. Thank you.